This is Reese from Polk County Public Health. Last week, Minnesota announced our Safe Learning Plan for this coming fall. As part of that, there was a key metric that was included to help school districts and public health across Minnesota make educated decisions, keeping the health and safety of our students and staff at the utmost of importance. One of the data points that was discussed is this, the 14-day COVID case rate by county. And I've had several follow-up questions, so I thought it warranted a short video. You will notice here that the description is number of cases by county of residence over 14 days per 10,000 people by the date of specimen collection or when a person was tested. Some people are looking at this 14-day case rate using the Minnesota Department of Health situational update page, which provides you with an update of how many new cases we have each date. This data is slightly different from that when we're going back to this key element, by the date of specimen collection. I'm going to now draw out how we got to Polk County's data for the last two 14-day periods. While I do that, I'm going to scroll down so you can follow along. And you will see here on the bottom of page 2, Polk County was 6.01 and 3.80. So how we got to that number was for 6/28 through 7/11, we went 12 divided by our population. The population that is being used to get to this data point is a 5-year estimate from the U.S. Census for the American Community Survey. And the 5-year estimate for Polk County is 31,591. We're going to divide that by 10,000 to get the per 10,000 rate. And so you will see here we get 3.80, matching over here. And then for the next 2-week period, we take 7/5 through 7/18. And we're going to apply that same principle. We had 19 data collection specimen divided by our population over the 10,000. And for this period of time, we get 6.01. For the next week, coming out on this Thursday, will be updated each Thursday. It will drop off a week. So it will drop off this week and keep this week and add a new week. So we'll have a number and we will apply that same principle. And that is how we get to the data point that's used here. You might say, why are we using 7 days? Why might some places are using 7 days, or some places are using other data qualifiers to talk about what's best for their community and where to start the conversation. So the idea of the 14-day rate, if I scroll back up here, the idea of the 14-day rate is because 14 days gives you a more stable time frame. 7 days, what we see with 7-day data in a county level is that it's very unstable and it jumps around a lot. So we're looking for that data to stabilize out a bit. Also, you'll notice that it's got a bit of a date lag, meaning like a 1 to 2 week date lag. And that's because we want to make sure that that data is clean and accurate. So for example, if someone has a positive case in Polk County, we call them and we ask them a series of questions as part of the case investigation. Sometimes when we complete that phone call, we learn that they actually live in Clearwater County, or maybe they live in Stearns County, or they may be living neighboring North Dakota. So it's really important for us to put that case under the county that the person is actually living. Furthermore, if there's new cases, we want to make sure that they haven't had a repeat case where it's being added twice. And so it's really important for us to have a good indication of the actual incidence of cases that we're seeing, as opposed to someone who maybe had one test and for one reason or another had to have another test. We only want to count them one time. And last but certainly not least, our incubation period is 14 days. And so this helps us better understand secondary infections that are happening during this time. While this is not the perfect measure, because no measure is, there's limitations with all data points, we use this as a starting place. I think it's important to mention that it's not the only place that we looked for data. We have conversations about what's happening in our county, across Northwest Minnesota, and across the state to better understand the data. What is the data? What are our local conditions? What's happening right here, right now, that helps us to make good decisions? Then school districts also need to evaluate if they are prepared. Can they meet the required and recommended health practices to be able to start school in the way that this recommended policy option might indicate? For example, right now we are in the 0 to 10 because we are in 6.01. So right now the policy option indicates in-person learning for all schools. Knowing all of this, this is a starting place. Then we add, what are the local conditions? What do we know about here and now? What do we know about is happening in Polk County? And then we pair that with the school's readiness and preparedness to have the capacity to serve its students and staff in the best way possible. And that is ultimately how we make the decision about our next steps for the fall. I'm very thankful for the Minnesota Department of Health and the Minnesota Department of Ed for having a very thoughtful process that keeps it a local decision and utilizing local data. Thank you.